Are there differences in health based on socioeconomic status? Breaking news in public health. The question on many people's minds today is, are there differences in health based on socioeconomic status? As recent studies highlight disparities, this topic is more relevant than ever. If you are curious about how income, education, and neighborhood conditions affect health, you are in the right place. Research shows that individuals with lower socioeconomic status experience worse health outcomes compared to those with higher socioeconomic status. People with the lowest income levels have up to 4.4 times higher odds of having multiple chronic conditions. This means that those living in deprived areas face greater health challenges. Pregnant women living in neighborhoods with higher socioeconomic disadvantage have significantly higher long-term cardiovascular risks. For instance, women in the most deprived neighborhoods have over twice the relative risk of elevated atherosclerotic cardiovascular disease risk compared to those in the least deprived areas. This is true even when accounting for individual income, education, and insurance status. Social determinants like income instability, access to education, and availability of healthy foods play a major role in health outcomes. These factors are shaped by how money, power, and resources are distributed. Adverse conditions contribute to avoidable health disparities. Insurance status is closely tied to socioeconomic status and affects survival rates in serious diseases like cancer. Patients without health insurance or those on Medicaid often have worse survival outcomes compared to those with private insurance. This highlights significant disparities in access to advanced treatments. Overall, socioeconomic status is strongly linked to health differences across various conditions and life stages in the United States. Lower socioeconomic status is associated with a higher disease burden, greater risk of cardiovascular problems, and poorer survival rates. This reflects the impact of social and economic factors on health. As we continue to address these pressing issues, understanding the connections between health and socioeconomic status is essential for improving public health outcomes. Stay informed and engaged as we monitor these developments.